Hi, welcome back to my A to Z video series on topics to do with pregnancy and perinatal mental health. My name is Dr. Erin Bauer and I'm a clinical and perinatal psychologist, and I also teach hypnobirthing. Today we're up to the letter P for partners. So whether you are the partner of a birthing woman or you're being made to watch this, I've got some tips for you. I've got 4 things to think about for what you can actually do on the day, because I think a big thing for partners is that they feel it's not about them, they don't have a role, they don't know what to do, and sometimes they end up feeling a bit useless or being accused of being a bit useless. So here are some simple things to try. I guess the key message is try something. Don't be the person who, while a woman is in the middle of transition, while she's really vulnerable and really not even able to talk, say, oh, is there anything I can do? Have an idea of what you might offer before. I always say it's better to be shoved away than to try and approach a woman in the throes of active labour and ask her open-ended questions like, can I do anything? So the first thing, as you might have guessed from the title, is thinking about, do you have some golf balls lying around somewhere or something mimicking golf balls? I know that sounds really strange, bear with me. Having something like that in your birth kit can be really, really useful because there are pressure points, acupressure points on the soles of your feet that are really good for calming and relieving anxiety. So if nothing else, you might just whip them out. Try having your partner put her feet on top of them and just roll them around if she's feeling a bit tense and a bit nervous. Now the risk is she might pick it up and throw it at your head, but that's the risk that you might want to be willing to take. So the nice thing about this suggestion is you don't actually have to be too particular about finding any acupressure points, worrying that you're in the wrong spot. I definitely always recommend for partners to learn a bit about acupressure. There's apps out there, there's lots of information available on YouTube to practice beforehand because it really does come in handy. MRI studies have shown amazing pain relieving properties from using acupressure. But if nothing else, stick some golf balls in your bag. You never know, they might come in handy. The next thing is thinking about cheerleading statements or coaching statements or affirmations or coping statements or whatever you want to call them. Sometimes during labour, phrases come out that are not natural or they're not helpful or they're things that you would never normally say. So you don't want to distract your partner by going, why are you saying that to me? That sounds weird. What I mean is practice beforehand, like actually say out loud some ideas that you and your partner have about phrases that might be useful. So not going by the kind of whatever birth book you're reading says, tell your partner she's amazing and doing a wonderful job. Like they're good things to hear if it's believable and it's what you want to hear. If you're spouting out phrases that don't sound like you at all, it's going to be distracting. So language is really, really important during labour, as I've already talked about. So sit down together and actually practice having these phrases thrown out. Now, again, it might be you get told to shut up, you get told to leave her alone, but having those statements ready that you both feel comfortable with, are using the own language that you would ordinarily use, that you're not couching things to worry about how you sound on the day, that's really important. So being a personal cheerleader, having your statements ready, I really, really recommend that. The next thing that I recommend to all my hypnobirthing couples, and it's something that you get taught how to do in classes, is to be your partner's brain. And by that I mean you be the person who is her advocate and who is the spokesperson, so to speak. The reason for this, why it's a good idea, is because birth is quite primal. It's really instinctive, and it's best if you are using that primitive, more emotional side of your brain rather than the frontal cortex where all the thinking and planning and rational behaviour happens. So that can be your job. I don't mean speaking for your partner, making decisions about them that don't include them or anything like that. I mean having had a sit down where you go through, you know, possible scenarios, potentially to do with interventions, whether it's, you know, cord clamping or what, you know, do you want the vitamin K shot after your baby's born? Do you want to go straight to a Caesar, or do you want to try something else? Do you want to wait? What do you want to do? So all those options that you've got, which you can research a bit about beforehand. I mean, you don't have to go crazy, but if you've got, you and your partner have got ideas about how you'd like things to go, then it's better for the birthing woman if you can be the person who's the spokesperson for that, because having lots of questions, having to think, having to plan, having to rationalize isn't optimal for a birthing woman. It's better to just let her do her thing, focus on her breathing, focus on keeping calm. The moment she's drawn out of that and has to think and make decisions, particularly when she's already in a vulnerable state and is feeling emotional and kind of overwhelmed and just distracted from all the sensation anyway, the harder it is. So it's a good idea for partners to take an active role rather than a passive one where you just kind of sit back and go, I don't know, whatever she wants to do. But you've discussed it beforehand. So if, for example, your partner has said to you, I don't want an epidural. Now, it doesn't mean that you have any power to override that or change your mind for her. But if she's asking for one and she's in that phase all too often where it's probably too late for an epidural anyway, you can be the person to say, well, actually our preference is blah, blah, blah. You know, as a first, I'm just talking as like a first line of action rather than having to interrupt her and say, would you like this? Would you like that? Because as I said, like women who are birthing really don't need to be interrupted with unnecessary questions unless of course it's an actual emergency and people's lives are in danger and she actually needs, you know, full attention to consent to something. The other thing, of course, is thinking about a toolkit. I always recommend partners pack their own bag or their own toolkit, so to speak. So, you know, you'll have your change of clothes and whatever else you need in your bag, but at the top of your bag, rather than putting everything in one bag, put the stuff that you know your partner might need immediately during labour, just so that you don't have to dig through bags and you know where things are. So, you know, hair ties, lip balm, chewing gum, bendy straws, like a favourite drink, those kinds of things, having those on the top of your bag, knowing where the iPod is and where the music is and all of that, that can be your job because she doesn't need to worry about that and you don't want to be going, where is, and then you're shuffling through a bag trying to find something and it just gets frustrating. So the other thing, of course, to think about is your own self-care. Like it's a difficult thing to talk about because of course birth is all about the birthing woman and less about the partner. But to be a good support person, any, you know, midwife, doula, birth worker will tell you, you actually have to keep your own energy levels up and your own sense of calm about you in order to be useful. So it might be things that seem silly, like packing a couple of Panadol. I don't mean for your birthing partner, I mean for you, because if you're in there for the long haul and you're not eating and drinking like you normally would and you get dehydrated and you get a massive tension headache, if you're in a hospital setting, you're not a patient of the hospital, so they can't give you anything. It might sound, you know, well, we're in a hospital, of course I can get a Panadol, but you can't. If you're not a patient of theirs, they're in no way obligated to give you anything. So it's better to have it in your bag if you need it than to think, okay, I've actually got to leave my birthing partner and go to a pharmacy and get it, or I've got to suck it up and just deal with the headache, which I suppose is a thing that a lot of people do, but you don't necessarily have to. Same with having snacks. It's always good to have snacks ready for your birthing partner, but keep your own energy levels up as well so that you're not getting stressed and getting tired, because of course there's no space for a birthing partner to say, oh, I'm tired and I'm not feeling wonderful. So yeah, don't be forced with the like suck it up and deal with it in silence. I'm saying just be prepared, get yourself organised. And these are all things that you can learn. Hypnobirthing has a whole entire section on partners and how to have them feel involved and active, and the difference that you see from people coming in at the start of the class who are maybe just a bit, oh yeah, I've been dragged along to this, something about childbirth, okay, who at the end are quite confident and quite competent and actually feel a sense of satisfaction that they have a role, they have something to do. As I said, just try something. It's better to try something and have something in your tool bag that you can just do and be brushed off, told to go away, whatever it is, than to sit there, stare at your phone, and then occasionally look up and say, can I do something? Be an active participant, be confident enough to know your partner and know what her preferences are, and definitely discuss it beforehand. Don't just walk into the day thinking, I'm just here to watch, I'm just going to stay at the top end and I'm not going to, you know, I don't want to know about any of this. You can be a really key component in whether your partner has a decent experience of birth or not, by your presence and by your support and by your advocacy. Alright, if there's anything to do with pregnancy, perinatal mental health, support for birth workers, mentoring, all those kinds of things, Look me up at drerin.com.au, and I'll put links below for any particular tools that I've mentioned in my social media, places you can follow me and all that sort of stuff. And I'll talk to you next time. Bye.